We are going to discuss the lymphatic drainage of the lower limb. But before in discussing the lymphatic drainage of the lower limb, we must know that what actually lymph is and how lymphatic system works. So as you can see that we have arteries, then arterioles and capillaries. So at the capillary level, due to osmotic pressure within the capillary, the plasma keeps on oozing out of the capillary through the capillary wall into the interstitial space, intercellular space. Look at in the background, we have got cells, these cells, these cells. So at the capillary and venule level, these red ones, the capillary, and the blue ones, venules, at this level, the plasma keeps on oozing out of the vessels or capillaries due to osmotic pressure. Now the plasma is among these cells. So this plasma needs to be taken back, otherwise there would be edema, a swelling of a tissue. If there is no mechanism of taking them back, then there would be edema. So it is a process which is in equilibrium. It means that the plasma keeps on oozing out of these capillaries and it's taken up by these green ones, green network. You can see this green network. All these are lymphatics. These are blind ended sacs, lymphatics. And these lymphatics, they take this plasma back to the circulatory system, but after passing through the lymph nodes, group of multiple group of lymph nodes. Here, lymph node is being shown, then another lymph node. These lymph nodes, these are actually, filters where T lymphocytes are present, lymphocyte white blood cells are present, who filter the plasma. If plasma contains any, foreign body, any bacteria, any toxin, that is filtered by these lymph nodes, and finally the lymph is taken back into the venous system here. You know, the plasma oozed from these, capillaries, means lymph was actually the plasma, ultrafiltrative plasma, and this, you know, what you call fluid is again taken back by these lymphatics into the blood. Okay, so this was a brief about the you know uh, lymphatics. Again, as you can see there, fluid leaks into the lymphatic capillaries from the body tissue. You know, leaks from these capillaries into the body tissue. Lymphatics collecting vessels collected from the lymph capillaries, and then lymph capillaries, these capillaries, they will collect the this plasma, oozed out plasma among the cells, and carries it to away from the lymph nodes. You know, then it moves it back to the blood, venous system. But on its way to the venous system, it's going to pass through different lymph nodes, which will act as a different filters. Now, I would be focusing on the lymphatic drainage of the lower limb. As you can see that these green vessels, if you watch them carefully, these green vessels, these are lymphatics, and the blue ones are the veins, great saphenous vein, and here we small saphenous vein. Now, if you look carefully, skin has been removed, and these structures, you know, these veins, cutaneous innervations, and lymphatics, they are present in the subcutaneous tissue outside the deep fascia. Here in the background, you can see deep fascia. So these are superficial lymphatics, like superficial veins. These are superficial lymphatics. Okay. Now there are two patterns for the lymph to carry lymphatic vessels to carry the lymph away from the distal part of the limb. Now look at these green vessels; they are converging and moving along with the great saphenous vein. Okay, so two patterns. One, in one case, the lymph accompanies the great saphenous vein and ultimately lymph reaches the superficial inguinal lymph nodes. These all are superficial inguinal lymph nodes. Superficial inguinal lymph nodes. Superficial inguinal lymph node. Okay, these are all superficial. Why superficial? Because they are present outside the deep fascia. These are present outside the deep fascia. In the background you can see deep fascia, and outside the deep fascia here lymph node group is present. These are called superficial inguinal lymph nodes. They are present just beneath the skin. Sometimes they swell up due to any infection in the genital area, in lower abdominal wall, or in the leg due to sepsis, or due to any ulcer, abrasion, and septicemia. These lymph nodes, they enlarge, and that condition is called lymphadenopathy. So lymph node in the inguinal area is comprised of two groups. One is horizontal group and other one is vertical group. So it is present in the form of alphabet T of you know alphabet A B C D T. T for tank. So they are present. It has got two bars or two arrangements: horizontal group and vertical group. So if you look carefully, these are superficial inguinal lymph nodes. These are present outside the deep fascia. They are not deep inguinal lymph nodes. But you look at them carefully, you would see that they are uh, draining the genitalia, scrotum, external genitalia. Then the horizontal group, this horizontal group, it has got again, this horizontal group has got further three groups: lateral group, intermediate group, and medial group. The medial one is draining the genitalia and scrotum. The middle one or intermediate one is draining the anterior abdominal wall below the umbilicus. Look, anterior abdominal wall below the umbilicus. And the lateral most group, it drains the gluteal region, because lateral aspect of the thigh and gluteal region. And this vertical group, all the lymphatics which were accompanying the great saphenous vein, this great saphenous vein, these lymphatics, they are accompanying great saphenous vein and its tributaries as well. And they ultimately drain into this vertical group of lymph nodes. This vertical group of lymph nodes. Okay. So, and this is other pattern. In second pattern, as you can see that small saphenous vein. Lymphatics, they are accompanying the small saphenous vein and its tributaries. And here you can see deep fascia has been cut or torn away just to show you underlying deeper structures. Here, this is deep fascia has been cut. Deep fascia has been cut. So these lymphatics, which are superficial ones, superficial lymphatics, they were accompanying the small saphenous vein, and finally, they drained into lymph nodes which are called popliteal lymph nodes. These lymph nodes, popliteal lymph nodes, are now deep lymph nodes because they were present beneath this deep fascia into the popliteal fossa, deep into the popliteal fossa. These are inguinal lymph nodes. Inguinal lymph nodes are superficial because they are present outside the deep fascia. Here in the background you can see white color deep fascia. All this is deep fascia. This deep fascia. Whereas popliteal lymph nodes, these are deep lymph nodes. These are superficial lymph nodes, and here these popliteal lymph nodes are deep lymph nodes. Then from these popliteal lymph nodes, The lymphatics would follow the deep veins. Look at this. This was superficial vein, small saphenous vein. It drained into popliteal vein, which is deep vein. And here we have got deep lymph nodes, and then deep lymphatics along with the popliteal vein, they pass up into the thigh along with the femoral vein. Here you can see. Now here we have got another group of lymph nodes here, small one. These are called deep inguinal lymph nodes. Now both are different. Here you can see this inguinal lymph node, these were superficial ones, and here these are, you know, deep inguinal lymph nodes because they are present within the deep fascia. As you can see that deep fascia has been removed. Then lymph passes to along the external iliac vein. This is external iliac vein. These are called external iliac lymph nodes. So in short, there were two patterns for the lymphatic drainage. One pattern was, accompanying the saphenous vein and great saphenous vein, and other pattern was, accompanying the small saphenous vein. The great lymphatics which were accompanying the great saphenous vein, they ultimately drained into the superficial inguinal lymph node, and from superficial inguinal lymph nodes to deep inguinal lymph nodes. Sometimes these inguinal lymph nodes, superficial inguinal, directly drained into external iliac lymph nodes. Now these are deep inguinal lymph nodes because they are present along the internal iliac vessel. Okay. Then second pattern, which was the superficial inguinal lymph node from the leg area, which were accompanying the small saphenous vein, they drained into popliteal lymph nodes. Popliteal lymph nodes were present within the popliteal fossa, along with the popliteal vessels within the fat. Then then lymphatics from the popliteal, lymph nodes accompanied along with the femoral vein here and enter the deep inguinal lymph node, then external iliac lymph node, and from here, the abdominal and thoracic, and ultimately to the venous system. So, but you have to be, vigilant about two lymphatic systems, two patterns. One was the one which was accompanying the great saphenous vein, other one was accompanying the small saphenous vein. Small one was drained into the, popliteal lymph node. The superficial great saphenous one was drained into the, superficial inguinal lymph node. Superficial inguinal lymph node had two patterns. These are, look, these are, I have shown this superficial inguinal lymph node. So horizontal group and vertical group. Horizontal group has been divided into further medial, intermediate, and lateral. This one is horizontal group, vertical group, medial, intermediate, lateral. This vertical group, it drains all the lymphatics from the lower limb, which was moving along with the great saphenous. Then genitalia was drained into the medial group. Then anterior abdominal wall was drained into the intermediate group, and the gluteal region, it drained into the lateral group. And these all lymph node finally drained into the, external iliac lymph node. So whenever there is infection or sepsis or any such condition, these lymph nodes are going to swell up. Those, people who are not aware of the, these presence of these inguinal lymph nodes, non-medical people. So most of the time they become very curious when they have swollen inguinal lymph nodes, because they think that there might be some genital, infection or something like that is going on, some cancerous condition. So you have to make them understand that it's not, and you have to examine the whole limb, anterior abdominal wall, gluteal region, genitals, just to make sure that the condition is not serious. And secondly, sometimes fundus of the uterus, it drains into these superficial inguinal lymph nodes. You have to also, be take that thing into consideration. So this was a brief about the lymphatic system. I hope it will help you out. Thank you very much.